Hello, I'm Mark. I'm the owner of Eclipse CPR Training in Tucson, Arizona. This is the streaming portion of your basic life support online streaming program. In this section, we're going to talk about rescue breathing. What is rescue breathing? Rescue breathing is when a patient, an adult, a child, or an infant, has a pulse, but they're not breathing or not breathing normally. In an adult, if you found an adult unresponsive, are you okay? Immediately call for help, yell for a defibrillator. If an adult has a pulse, but they're not breathing or not breathing normally, you'll need to give rescue breathing with a bag mask. This device is connected to 15 liters of oxygen. We hold the mask with a letter C and place a letter E, our fingers look like an E, on the jaw with our smallest finger under the angle of the jaw, and we squeeze the bag with a couple of fingers, and we give one breath every 6 seconds. This is a new policy. As of October 2020, we're now giving one breath every 6 seconds for adults who have a pulse but are not breathing or not breathing normally. That's new, and it's in your required 2020 American Heart Association healthcare provider manual. With infants are a little different. With infants, we slap or flick the foot to determine unresponsiveness, call for help, call the code team. We find the pulse at the brachial artery or at the femoral artery. If the heart rate in an infant is less than 60, it's in your manual, this has been one of our policies for decades. If the heart rate is less than 60 with signs of poor perfusion, with infants, we might get the smaller bag, a little smaller C, a little bit of a smaller E, and we give one breath every 2 to 3 seconds per the latest guidelines, October 2020, that were released nationwide. With infants, if the heart rate is less than 60 with signs of poor perfusion, we won't just give breaths. On infants and children with heart rates of less than 60, we'll actually begin compressions. Just because an infant, or a child for that matter, has a pulse, it must be greater than 60. In infants and children with heart rates of less than 60, with signs of poor perfusion, poor skin color, blue and purple, we begin compressions and breaths. But if an infant has a heart rate of 120 with no signs of poor perfusion, we would simply give the breaths. This is in your American Heart Association BLS manual, and it's all new. It's been updated as of October 2020. Rescue breaths, one breath every 2 to 3 seconds. That's 20 to 30 breaths a minute for an infant or a child that has a pulse greater than 60, no signs of poor perfusion. You're simply giving the breaths. With adults, if they have a pulse, we are concerned if it's slow, and that can be treated with medications by paramedics and in the hospital. With adults, we are concerned if the heart rate is slow, but we won't give compressions if the heart rate's under 60. As long as they've got a pulse, we'll simply begin rescue breaths. One breath every 6 seconds. That's about 10 breaths a minute. For adults, infants, and children, rescue breathing is about 20 to 30 breaths a minute, and that's a significant change from past guidelines. Again, I'm Mark with Eclipse CPR Training in Tucson, Arizona. Please review your mandatory basic life support textbooks that are required before, during, and after your program. Thank you so much.